Dear student nurses, today we are going to discuss some of the important topics related to your examination from genetics. So the first topic is regarding mutation. So mutations are changes in the base pair sequence of the genetic material of an organism. It is caused by copying errors in the genetic material during cell division by exposure to ultraviolet or ionizing radiation, chemicals or virus. So some of the disease condition related to it is sickle cell anemia, cystic fibrosis, some cancers, leukemia, breast cancer, so fragile X syndrome. So these are the example. This question will be coming in form of very short answers or either as multiple choice question. They can give you this topic. So second is karyotyping. Karyotyping, it is the laboratory test used to study an individual's chromosome makeup. So it is a test which is used to study about the individual's chromosome makeup. So in this test, chromosomes are separated from cell-stained and arranged in order from largest to smallest so that their number and structure can be studied under a microscope. So in laboratory, the chromosomes are separated and stained, separated from cell, then it is being stained and arranged from the largest to smallest so that their number and structure can be studied under a microscope. So that is about karyotyping. And the third question is define mitosis. So it is the process of nuclear division in eukaryotic cells that occurs when parent cell divide to produce two identical daughter cell. Okay, the parent cell divides to produce two identical daughter cell. So you may be knowing it is divided into 5 stages: prophase, prometaphase, metaphase, anaphase and telophase. Okay. So next is regarding inborn errors of metabolism. This is a frequently asked question. So we'll go. Disorders of carbohydrate metabolism. The first category of inborn errors of metabolism is disorders of carbohydrate metabolism. Example is glycogen storage disease. So we will discuss each one in detail. So, glycogen storage disorder is the process of accumulation of glycogen within the muscles and liver. The second category is disorder of amino acid metabolism. This question is frequently asked. Specifically mention the disorders of amino acid metabolism, inborn errors of amino acid metabolism. So the example is phenylketonuria, maple syrup urine disease, glutaric acidemia type 1. So phenylketonuria, it is an autosomal recessive metabolic disorder. It is an autosomal recessive disorder. Deficiency, it occurs because of the deficiency in hepatic enzyme phenylalanine hydroxylase. So because of these, it can affect the brain development, which may lead to mental retardation, seizure, etc. So that is about phenylketonuria. So here we have to note down that it is an autosomal recessive disorder. That is also a question. Next disease is maple syrup urine disease. So it is also known as ketoaciduria. It is also an autosomal recessive disorder. It affects the branch chain amino acid and their toxic product will be released in blood and urine. So it is also an autosomal recessive disease. Then glutaric acidemia type 1, it is an inherited disorder in which the body is unable to break down amino acid completely. This can also cause damage to the brain. So next is the disorders of organic acid metabolism, that is alkaptonuria. The example is alkaptonuria. So it is also known as black urine disease. It is an autosomal recessive disorder due to the defect in the enzyme homogenisate. Next category is disorders of steroid metabolism, that is congenital adrenal hyperplasia. So congenital adrenal hyperplasia, it is an autosomal recessive disorder because of the excessive or reduced production of sex steroid. And next one is lysosomal storage disorder. We call it as Gaucher's syndrome. So Gaucher's syndrome, it occurs because of the lipids that accumulate in the bone marrow. Okay, it is a fatty acid substance known as sphingolipids that build up in the bone marrow. For that condition, we call it as Gaucher's disease. And some of the other disorders are celiac disease and galactosemia. So celiac disease, it is an immune reaction when we take the food content with gluten. So example like wheat, barley and all. And galactosemia, it is due to the inability of the individual to metabolize the sugar galactose. Okay, that is galactosemia, inability of the individual to metabolize the sugar known as galactose. So this is the simple form of inborn errors of metabolism. There are many errors that cause because of metabolism. So we have briefed it into disorders of carbohydrate metabolism, disorders of amino acid metabolism, disorders of organic acid metabolism, disorders of steroid metabolism and lysosomal storage disorder. So the main inborn errors of metabolism, simply we can tell: glycogen storage disease, phenylketonuria, maple syrup urine disease, alkaptonuria, congenital adrenal hyperplasia, Gaucher's syndrome, celiac disease, galactosemia. The next we will discuss about Edwards syndrome. It is also known as trisomy 18. So it is a genetic disorder caused by the presence of all or part of extra 18 chromosome. So majority people with this syndrome die during fetal stage. So we can see congenital heart defects, growth retardation, spina bifida and facial cleft. So what is trisomy? It is a chromosomal condition characterized by additional chromosome, and the most common types of autosomal trisomy are trisomy 21, which is Down syndrome, trisomy 18, Edwards syndrome, trisomy 13, Patches syndrome and trisomy 8, Fanconi syndrome. This is very important. So they may be asking you to list down some common types of autosomal trisomy, that is Down syndrome, Edwards syndrome, Patches syndrome and Fanconi syndrome. And next is regarding Turner syndrome. So Turner syndrome is a genetic condition that affects only females with one partial or missing X chromosome. So when they are asking you to list down some chromosomal disorder, you can write Turner syndrome as an example. Then sickle cell anemia, it is a group of disorder with atypical hemoglobin molecules called hemoglobin S, which can distort red blood cells into sickle shaped. Okay, it is with atypical hemoglobin molecules called hemoglobin S, which make the red blood cell into sickle shape. And next is the types of neural tube defects, that is spina bifida, anencephaly, encephalocele, lipomyelocele, lipomyelomeningocele. So these are the types of neural tube defect. This is also an important question. Next, which are the inborn hematological disorder? Hemophilia A, B, C. Then sickle cell anemia, we can write von Willebrand disorder, antiphospholipid syndrome. Then maternal infection that affect the fetus, that are cytomegalovirus infection, herpes simplex virus infection, hepatitis B, syphilis and rubella. Then this is a question: what are the various procedures or techniques for prenatal diagnosis? This was a frequently asked question in genetics, that is ultrasonography, amniosynthesis, chorionic villus sampling, maternal serum alpha fetoprotein test, maternal serum beta HCG test and pregnancy associated plasma protein A test. These are various procedures or techniques for diagnosing prenatals. And now we'll see regarding congenital disorders. This is also a frequently asked question. List down few congenital disorders, or either it will be asked in multiple choice question. Okay, so some of the congenital disorders are cleft lip and cleft palate, cerebral palsy, Down syndrome, spina bifida, Fragile X syndrome, cystic fibrosis. And what is apoptosis? So apoptosis is a process of programmed cell death which is used during early development to eliminate unwanted cells. Then next is eugenics. This is also a frequently asked terminology. So eugenics, the word is coined by Francis Galton. So it means good born, or we call it as well born. So eugenics is the science which deals with all influences that improve inborn qualities of a race. So it is a science which deals with all influences that improve inborn qualities of a race. So eugenics is of two types, there is positive and negative, and the aim of eugenics is to create healthy community. So please note this question. The next is sex-linked inheritance disorders. Some sex-linked inheritance disorders are Alport syndrome and Fragile X syndrome. Then what is meiosis? So meiosis is the cell division that include reducing the chromosome number as preparation for sexual reproduction. So meiosis occurs in sexual reproduction. So it creates gametes. So genetic information is exchanged during this process. So genetic information is exchanged during meiosis. Don't get confused with difference between meiosis and mitosis. This is a frequently asked and an important topic in genetics. So being nurses, what is the role of nurse in genetic counseling? Or else they may ask, what is the role of nurse in genetic service? So generally we can write what is genetics and the role of nurse. So here, if it is asked regarding the role of nurse in genetic counseling, we can start by writing what is genetic counseling. So genetic counseling is a communication process by which patients or relatives at the risk of genetic disorders are made aware of the consequences of the disorder, its transmission, and the ways by which this can be prevented or mitigated. So here the role of nurse is awareness regarding the consequences of the disorder, its transmission, and the ways by which this can be prevented or mitigated. So we can start our answer like this also. The role of nurse in genetic service is to make awareness of the consequences of the disorder, its transmission, and the ways by which this can be prevented or mitigated. And some of the roles of genetic nurses: taking family history, constructing a family pedigree, attending patient's concern, explaining genetic test, obtaining informed consent and collecting blood samples, giving the results of the genetic test, psychological test, and follow up to the family. These are the important roles of nurse during genetics. Okay, that is family history, constructing family pedigree, attending patient's concern, explaining genetic test, obtaining informed consent, collecting blood sample, giving the results of genetic test, psychological test, and follow up. Then generally we can write the role of nurses: counseling, education service, testing, diagnosis, and supervision. This you can add either in the introductory part or else generally. The role of nurse in genetic service is like we are having the role as a supervisor, as counseling, as educating, as testing, and we play a major role in diagnosis. Okay, before diagnosis and after diagnosis, before testing and after testing, and educating regarding consequences of the disorder, transmission, so and the ways by which this can be prevented or mitigated. And the other aspects of care we can focus, that is guiding a woman or couple through prenatal diagnosis. So inside diagnosing we can write guiding a woman or couple through prenatal diagnosis and helping the parents to make decision in regard to prenatal diagnostic research. So we can provide a psychological support and we can help the parents to make a decision, and assisting the parents who have a child with birth defect. So we can provide genetic counseling by assisting parents who have a child with birth defect and providing support to the family dealing the emotional impact of birth defect. So they will be having psychological problems, so we can provide support and coordinate these services. Okay, so there will be many other professionals who are involved in genetic service, such as social workers, physical and occupational therapists, psychologists, and dietitians. So we can collaborate with them by providing